Hi everyone, I'm Neo Hensel. I'm a veterinary dermatologist practicing in Basel area in Switzerland. I'm originally from Japan, but graduated from veterinary school at Colorado State University in the USA. I did an internship in Boston area and then a 3-year veterinary dermatology residency in Georgia. And then I got the diploma of ACVD. After I completed the residency, I moved to Switzerland because my husband is Swiss, and some of you may already know, but he's also a veterinary dermatologist. But we decided to open a practice in the Basel area, which is his hometown. And since 2014, I live in Switzerland and practice in veterinary dermatology. So, welcome to Benefits of Probiotics in Veterinary Dermatology. I'm quite excited about this topic because, I'm pretty sure you have used probiotics in your regular practice daily, maybe. But when you use probiotics, often that is the time when your patients have GI problems. When you get a phone call, hey dog, my dog has diarrhea, what do I do? Well, just bring them in and then we treat with diarrhea. And probably you can also use probiotics. That's often a lot of the cases you use probiotics in your daily practice. But we can also use probiotics in veterinary dermatology. You may not know, but we can also use those probiotics in canine atopic dermatitis, food adverse reactions. And when your patients have bacterial pyoderma, you have to treat with systemic antibiotics maybe. And when you give systemic antibiotics, often you may get phone calls a few days later and then say, oh, my cat is getting diarrhea after antibiotic. My dog is getting diarrhea and vomiting after antibiotic. And for those cases, you can also throw some probiotic to help those GI side effects from antibiotic administration. What is probiotics? Probiotics are live microorganisms. It's important. It's live microorganisms, which, when administered in adequate amounts, confer a health benefit on the host. Basically, when you give live microorganisms, that helps to promote the good health in patients. And then I want to show you a little bit about the importance of the gut microbiome. Here's that diagram, really nice diagram. You see that intestinal cells lined up, and then inside you can find gut microbiota, metabolites, and genes. And among those intestinal cells, you can also find immune cells, which you can see here in green. Looks like a dendritic cells, not just the dendritic cells, but you can also find the lymphocytes and stuff too. Actually, in mammals, 70 to 80% of the immune cells are found in gut, in the intestine. So it's actually important, not just those, gut, but also it affects the immune system. But how are they connected? Because that structurally, you can see those blood vessels and the enteric nervous systems are surrounding those enterocytes. And so they are the one communicating with other body systems, like, cross-talking between each other with the different organ systems. So probiotics, when you think about probiotics, it is not a medication per se, it's a supplement. So you can also use it in healthy animals. So let's look at first the benefits in healthy dogs. Obviously, probiotics regulate GI microbiota, which improves the health by reducing bad bacteria like fecal Clostridium species or E. coli, or increasing good bacteria like fecal Lactobacillus species or Bifidobacterium. It's interesting, if you compare elderly dogs or young dogs, their microbiota is a little bit different. So if you give probiotics, it has shown probiotics given to elderly dogs, those GI microbiota shift to younger microbiota. I found it quite interesting. And it's not just the bacteria, they change, but also affect the immune system. So change in fecal secretory IgA, serum IgG, TNF-alpha. So again, those microbiota population affects the immune system. So those immunomodulation in the healthy dogs, multiple studies have shown immunomodulation increasing the fecal IgA, and not just in the fecal, but also in the bloodstream. Remember, gut are connected to the immune system through the bloodstream. So they also have shown increased serum IL-6, TNF-alpha, IgG, and interferon alpha. And there is a study using the Fortiflora supplementation of food with Enterococcus faecium SF68, that is the probiotic found in Fortiflora, stimulates immune function in young dogs. There are two groups, divided in two groups, control and a Fortiflora group. And both group fed control diet. Control group is just a diet, and a Fortiflora group, they also received this Fortiflora from weaning to 1 year of age. And they checked the fecal IgA, serum IgG, IgA, and a proportion of lymphoid cell subset. And the results are, in the probiotic group, they have shown increased fecal IgA, and interestingly, these are the young dogs, canine distemper virus vaccine specific circulating IgG and IgA were higher, so they are better protected, seem to be better protected. And then they also have shown in the probiotic group increased population of mature B cells. Those mature B cells are the ones producing the antibodies. So it seemed to be well prepared for any infections, and then it's showing a good immune system compared to the control group. So we talked about the healthy animals. Now let's talk about sick patients. What can we use for what kind of sick patients? Probiotics can be used like GI diseases, obviously, has been shown to show a good results in a chronic kidney disease, as well as atopic dermatitis. In cats, you can also find those studies used in herpes virus, and seem to show like benefits in milder cases. But here we talk about GI diseases and of course atopic dermatitis, because we are dermatologists and we want to talk about skin today. So let's first talk about gastrointestinal disease. There are many studies have shown improvements of clinical signs of GI diseases, such as Saccharomyces boulardii used in a chronic enteropathy. So for this case, they use this probiotic for 60 days with the standard treatment for chronic enteropathy. And they have shown the improvements in canine chronic enteropathy clinical activity index, stool consistency and frequency, and body condition score, Remember, these chronic enteropathy, they often cannot absorb the nutrients because of this disease, but feeding 60 days of probiotic shown an improvement in a body condition score. And this study used Fortiflora. It's an evaluation of metronidazole with and without Enterococcus faecium SF68 in shelter dogs with diarrhea. This study was led by Dr. Lapin in Colorado State University. If you think about those shelter situation, it is a quite stressful situation. So many dogs in a shelter environment, they get diarrhea. So they are wondering if probiotic can help to combat those diarrhea in a shelter environment. So in this study, there are two groups, 16 dogs each for control. So without Fortiflora and Fortiflora group. And they gave metronidazole on both group, and a Fortiflora group, they received additional Fortiflora for 7 days. So they looked into the fecal score and did the fecal test before and at the end of the treatment. And the results showed 37.5% in a control group and 68.8% in Fortiflora group reached normal stool by day 7. If you just look at the number, it seemed to be like a Fortiflora group, like it has a significantly high number, but unfortunately the p-value is 0.1556, which is quite a high number, and so they didn't reach to that statistically significance, but you can see the numbers are quite high in a Fortiflora group. And the interesting thing or finding from this study is actually when they did the fecal test, 2 out of 16 dogs in a Fortiflora group, they had a Giardia cyst at first beginning of the study. And 7 of the control group had a Giardia cyst. And then after the treatment, 7 days was metronidazole plus minus Fortiflora. Giardia cyst, they also again looked into it, but the two dogs in a Fortiflora group, they didn't have any more Giardia cyst at the end of the study, whereas only one patient eliminated the Giardia cyst. So meaning 6 out of 7 control groups still had a cyst at the end of the study. This number is too small, really too small. So statistically, you cannot run statistics for this, but I found it quite interesting. So if you have maybe bigger number, then you might be able to find some statistical interesting numbers. So it is interesting. And then so the next study I want to show is the idiopathic inflammatory bowel disease, and that is the one, IBD is something also seen in internal medicine, but also in dermatology as well, because IBD pathogenesis is not well understood. So that means, it's also talked about maybe IBD is allergy associated, food allergy associated. So that is the reason we sometimes see IBD patients as well. So this one comparison of microbial, histological, and immunomodulatory parameters in response to treatment with either combination therapy with prednisone and metronidazole, or probiotic BSL number 3 strains in dogs with IBD. So they had 10 dogs for 2 groups, 10 dogs each for 2 groups. One group was fed probiotic, The other group was treated with prednisolone metronidazole for 60 days, and they monitor during the treatment and 30 days after the treatment. So the results showed both groups showed improvements in canine IBD activity index and duodenal histology scores, and decreased CD3 positive cells. So both groups did improve, but in addition, probiotic groups, they showed significantly increased FOXP3 positive cells and TGF beta cells. Those are the regulatory T cell markers. So that means they are enhanced, they have enhanced and regulatory T cell population. And also showed significant increase in Faecalibacterium abundance, meaning they actually normalized that dysbiosis in the gut. And then the last study I want to show for the GI disease is that, of course, elimination food trial. Those food allergic patients, some of them, not always, but have GI symptoms like diarrhea or soft stools. And for those patients, the diagnostic test we do is the elimination food trial. You know, those when you do those tests, you know, there is no one perfect food. So you have to tailor for each patient because each patients are different. Each patient have probably different allergens in food. And then based on the history and what kind of food they had, what kind of food they didn't tolerate, we tailor or choose the best, hopefully, the diet for the elimination food trial. But of course, those patients, you know, we get a phone call a few days after I started the elimination food trial, my dog now has diarrhea. So, you know, those cases, it's a little bit difficult. So anyhow, so this study looked into effects of probiotic bacteria in dogs with food-responsive diarrhea treated with an elimination diet. In this study, there are 21 dogs with food-responsive diarrhea. And they divided in two groups. Both groups were fed novel protein food, salmon and trout Purina canine LA, and one group received placebo, and the other group received probiotic for 4 weeks. And they looked into intestinal tissue samples and feces collected on days 0 and 28. And they looked into canine IBD activity index, various cytokines, and several bacteria. So the results showed both groups' canine IBD activity index improved. So clinical, they improved it, and then decreased the Enterobacteriaceae. In addition, a probiotic group, they had increased colonic interferon gamma messenger RNA and increased good bacteria lactobacillus species. When you look into cytokine patterns, both groups, they were not associated with the clinical features. So both groups, they did improve with the novel protein diet, but the probiotic group had a little bit more benefit compared to the control group, placebo group. So finally, let's look into probiotics and skin. I want to talk just a little bit about gut-skin axis. Gut-skin axis, there is that skin homeostasis, which is that balancing act among the skin system, right? And then another one is a skin allostasis, and skin allostasis is the one taking a balance, making a balance from the outside environment and the skin. And gut microbiome is playing an important role to both skin homeostasis and skin allostasis, because they also have not just one direction, they affect each other, communicate, remember, through the blood vessels. They communicate each other to promote this gut-skin axis. So if there is a skin dyshomeostasis, then that leads to psoriasis, atopic dermatitis, and acne. And when you, interestingly, with the patients who have skin lesions, they often have GI disorders as well. So that also shows there's a connection between gut microbiome and the skin. And then that is called gut-skin axis. So when we look at good gut ecology, the GI enables immune tolerance and provides protection from dietary and environmental allergens and pathogens. And commensal bacteria prime those gut immune system, which is between the bacterial antigens and the pattern recognition receptors. And there's adaptive immune system in the gut ecology as well. They induce the IgA and maintain the homeostasis between the effector T cells like Th1, Th2, Th17, which are important players. They are the important players in atopic dermatitis, as well as regulatory T cells, also important in atopic dermatitis. In addition, short-chain fatty acids played an important role. They are the products of dietary fibers fermented by gut microbiome, and they have a protective role against the development of inflammatory disorders such as arthritis, allergy, and colitis. So if this gut microbiota is altered, they actually produce more effector than the regulatory T cells, which has known to develop that causes the autoimmune disorder as well. So gut ecology, that homeostasis in the gut ecology is really important because that affects the all different organs, the whole health system. So let's talk about the skin homeostasis just a little bit more. There's a diagram of this epidermis from the stratum basalis, spinosum, granulosum. Lucidum is basically an artifact, so we usually don't talk about. It's a part of granulosum. And then stratum corneum is the one very outside, protecting the skin, or should I say the whole body from the environment. And when you look into the stratum corneum closely, it's called brick and mortar model. But the corneocytes, there are so many corneocytes layered to each other, but they have to be tightly tied together by corneodesmosome or lipids, because that is the one, the most outside layer of epidermis protecting the body from outside, like environment, like allergens or like bacteria, those microorganisms. And then also not just that, they actually, by keeping those tight connection, they are keeping all that waters inside of the body. So how those effects of that gut commensals on a systemic immunity is, so the gut microbiomes and metabolites like retinoic acid, polysaccharide A, they promote T regulatory cell accumulation, which is the anti-inflammatory. However, those filamentous bacteria, they promote accumulation of pro-inflammatory Th17 and Th1 cells. So they have, they do some different stuff, but it's important to keep it like, suppress each other to keep the balance. And short-chain fatty acids, they suppress immune response and regulate activation and apoptosis of immune cells. So they play a quite important role in the immune system, because we don't want too much activation, because that actually causes the autoimmune disease because it's acting too much. So, activating at the same time by doing that apoptosis, they are actually keeping a good balance, and that's the homeostasis. So if the intestinal barriers, if they are disturbed, actually what happened is microbiota metabolized, those can reach the bloodstream. And like I said, those through the bloodstream, they can also reach to the skin, and that causes the disruption of the skin homeostasis. Again, that's the gut-skin axis. So the influence of the gut microbiome to the skin microbiome, when you look at propionic acid, which is a short-chain fatty acid, they have shown to have antimicrobial effects against methicillin-resistant Staphylococcus aureus, naming the strain of MRSA USA 300. So it has a really good effect on that. And my administration of probiotics, they increase the dermal thickness, as well as increasing the folliculogenesis, sebocyte production in mice. They have a significant decrease in transepidermal water loss and promote epidermal differentiation. And it's dose dependent, but increasing the profilagrin. And profilagrin is an important precursor to make the filaggrin. Filaggrin, as you can see in this diagram, filaggrin has an important role in a skin barrier. It's found in corneocytes. So, the profilagrin in the granular cell, they get metabolized and eventually become filaggrin, which plays an important role in a skin barrier. And then it is also found in humans, there is a quite a significant relationship with that mutation of the filaggrin and atopic dermatitis. So let's look at now skin allostasis. So the intestinal microbiome plays a role in skin allostasis via innate and adaptive immune systems. So if you give probiotics, it has shown to decrease the severity of sodium dodectyl sulfate-induced dermatitis and transepidermal water loss. As you can see in this diagram, on the left side, the gray part is a stratum corneum. And then you can see those dots, those are the corneocytes. They are quite nicely lined up and then tightly, attached to each other. So by having those well-organized stratum corneum, they prevent transepidermal water loss, and as well as preventing those exogenic factors like germs and bacteria coming through stratum corneum to the inside of the body. Whereas on the right diagram, you can see those corneocytes are all over. They are not really tightly adhered to each other. When this happens, there is a high transepidermal water loss. So you are losing all the water, not all, but losing a lot of water from inside to outside, and then at the same time, because the barrier is not protecting your body that well, so exogenic factors like germs and bacteria, they can come through the stratum corneum, invade into the body. And also administrating giving the probiotic has shown the decreased sign of reactive skin inflammation like mast cell degranulation, vasodilation, edema, TNF-alpha release, as well as increased FOXP3 positive T regulatory cells, which has shown to promote the faster wound healing, decrease apoptosis-mediated skin inflammation. So now let's finally look at atopic dermatitis. And then just a really, really brief pathogenesis. It's so complicated and we don't know everything about the pathogenesis of atopic dermatitis yet, but very, very simplified version. We already know there is a skin barrier dysfunction. We already talked about it, but in humans, gene mutation of filaggrin has shown to increase transepidermal water loss and penetration of antigen through the corneocytes, through the skin. And they also have an altered immune response. The acute here in the middle, you can see the diagram. This acute site, acute phase of the atopic dermatitis, it is mainly dominated by Th2 response, whereas a chronic, eventually, so the acute phase become chronic, which is played dominantly by Th1 response. And the bad thing is during the chronic phase, they also experience flare-ups. And those flare-ups are actually acute phase. So from the chronic phase to acute phase, and the acute phase to chronic phase, and then acute phase, chronic phase, acute phase. So they cause pretty bad cycle. And that's why we have a lot of the atopic patients having like a really chronic and then struggling with that intermixed with acute phase clinical signs. And I want to introduce a little bit about diet microbiome theory. This theory is basically the Western diet nowadays. What we eat is a low fiber and a high fat diet that decreases the immune homeostasis. That's the whole idea of this diet microbiome theory. And immune homeostasis begins with from maternal microbiota. So even when you are not born yet in the mother's womb, that's where it starts. And then after you are born, if you're fed breast milk components, which is composed of maternal microbiota, affected by maternal microbiota, and then once you start eating food, those food and the environmental microbiome, they affect the whole immune homeostasis. And then so those Western diet, they lead to the decreased production of immunomodulatory metabolites, specifically talking about the short-chain fatty acids. And one study has shown a decreased Faecalibacterium prausnitzii and short-chain fatty acids in atopic dermatitis, which kind of also related to this diet microbiome theory. And if those intestinal barriers are disrupted, they actually allow the penetration of those microbiomes and toxins delivered to the skin by bloodstream. Again, that's the gut-skin axis. And that causes the Th2 immune response, which is the main player for the acute phase atopic dermatitis. So probiotics, using the probiotics may be useful in prevention and treatment of atopic dermatitis by modifying the microbial composition, preventing pathogen invasion, restore impaired barrier function, or inhibit pro-inflammatory cytokines IL-4, TNF-gamma, or IL-17. Or on the other, completely differently, they promote the anti-inflammatory cytokines like the IL-10, TGF-beta. They can also increase the T regulatory cells, which decreases or inhibit Th2, Th17 subtypes, which played a quite important role in atopic dermatitis. When you look into the mouse model, they have shown upregulation of CD4 positive, CD25, FOXP3 positive T regulatory cells, and downregulating IL-4 and thymic stromal lymphopoietin. It also has shown to inhibit house dust mite-induced dermatitis by IL-10 and altering Th1, Th2 balance, because the balance is always important. It has also shown to suppress the mast cell-mediated inflammation. What about humans? Humans, they have shown, it's quite a good study, interesting study, but they gave probiotics during a prenatal and a postnatal period and have shown the efficacy in the management and the prevention of atopic dermatitis in high-risk infants. There are, other studies, not really supporting this, but there is definitely evidence that providing that probiotic to those prenatal, postnatal period seem to show that a good effects in atopic dermatitis. And then also decreased in the severity scoring of atopic dermatitis index in humans. What about dogs? Canine atopic dermatitis, there's a good study. So this study, evaluation of Lactobacillus rhamnosus strain GG for the prevention of atopic dermatitis in dogs, done by Dr. Masala in Florida. So she had 2 adult beagles with a severe atopic dermatitis. So she bred those 2 beagles twice each, okay? And total, she got 16 puppies. What happened? And then those all 16 puppies are sensitized with D-farinae house dust mites. So they also have atopic dermatitis. What she did is the first litter, she just bred normal. Did nothing, just normal. And just sensitized with D-farinae. Second litter, what she did is actually she gave probiotic during for the second pregnancy. So during the pregnancy, she started giving a probiotic. And then when the puppies were born, from 3 weeks to 6 months of age, she continued feeding probiotics. And then they took the blood sample every 6 weeks and performed the intradermal test at the 6-month-old. So first litter did nothing. Second litter, she gave probiotic during a pregnancy and a 3 weeks old to 6-month-old of 6-month-old age. So the first litter, she had 7 puppies. And all the puppies had strongly seropositive for D-farinae IgE antibody. 6 out of 7, so vast majority of them had positive, or should I say almost all of them had a positive intradermal test for D-farinae. And all of them developed severe clinical signs of atopic dermatitis. Whereas the second litter, that's the one fed probiotic during a pregnancy and after they were born. There are 9 puppies, but 7 out of 9 puppies are seropositive for D-farinae IgE antibody, and only 1/3 of them had a positive intradermal test results. And 6 out of 9 developed dermatitis and pruritus after the challenge. And what she found was actually those second litter who were fed probiotic had significantly lower IgE level and milder intradermal test reactions compared to the first litter didn't get any probiotics. Clinically, she didn't find any difference between the first litter and the second litter based on the clinical scores. So I found it quite interesting, but she actually did not stop there, and she did this follow-up study. So 3 years later, after she discontinued giving the probiotics, she looked at those puppies again. They are now adults, So 7 control dogs and 9 probiotic-fed dogs. And she challenged them with ragweed, Timothy grass, and D. farinae house dust mites, and checked the CADESI score, which is the clinical scoring system for canine atopic dermatitis. Check the allergen-specific IgE antibody in serum, IL-10, TGF-beta. So the results show in the probiotic group, they had increased IL-10. That's the good cytokine. And there is no difference in IgE and TGF-beta. In probiotic group, CADESI scores were improved. So she concluded that early administration of probiotic has long-term immunological and clinical effects because they did not get any probiotics for 3 years. But the probiotic group seems to have better immune system, when it comes to canine atopic dermatitis. They have more IL-10 for more like a protective effect. So I found it quite interesting in this study. And there are different studies as well. So the next study is a double-blind placebo-controlled trial of probiotic strain Lactobacillus sakii Probio 65 for the prevention of canine atopic dermatitis. I think the title is a little bit misleading because it's not really prevention of canine atopic dermatitis appearance per se, but more like the prevention of, I'd say, or like a reduction of clinical signs. So this study had 32 dogs with canine atopic dermatitis. One group had a placebo, and then the other group had probiotics for 2 months. And then what I liked about this study is a double-blinded placebo-controlled part. And the results show the reduction in a CADESI score in a probiotic group. So, seems to have a probiotic is helping to reduce the clinical signs in these 32 dogs study. The other study I want to show is the clinical trial of oral administration of different probiotic, Bifidobacterium longum, in dogs with atopic dermatitis. This one, that they fed this Bifidobacterium longnum for 12 weeks to the dog with atopic dermatitis. And the results show the reduction in CADESI score. So clinically, they seem to be better, but they had no change in transepidermal water loss, pruritus visual analog scale, and medication scores. And what I want to point out is a CADESI score is developed for researchers to more objectively look into those clinical signs. And so there are so many different areas. So let's say you look into the axilla, and axilla, is there any erythema? If so, what's the grade? Excoriation, what's the grade? Lichenification, what's the grade? So, you have to do that for each part of the body. It's quite extensive. But this study showed no change in pruritus and medication. And then those are the more important part for our owners, like clients, because owners, they may look at the skin, but a lot of people don't look into it too much. Maybe what they often notice is the erythema, but otherwise they don't look at excoriation. They don't look at much like lichenification. What's more important is pruritus, because that's what they see, and that's often the chief complaining we get. My dog is itchy, please fix, right? But if you don't find that, if you don't find any change in the pruritus, or the amount or the type of medication you're using, if they don't change, then an owner may not be too convinced to use probiotic in canine atopic dermatitis. So what I want to say is probiotics used in canine atopic dermatitis, there are, I just, only show like a few studies, but they have mixed results. They may be showing a good result, but, they may not show that much of improvement. But you have to remember they use different strains of probiotic. Each strain has different effects. So you cannot compare probiotic A to B straight difference. You can't. And that doesn't mean probiotic A doesn't work for this. So that means probiotic B also doesn't work. It doesn't mean like that. Probiotic B may work fine. So, you have to think about that too. And unfortunately, there is not many studies done in the relationship between the probiotics and a canine atopic dermatitis. So after all, we need more studies. And probiotics, I just, said there are so many probiotic species and they are not made equally. So, I already talked about this. And then in addition, there is a problem with product stability, because how much, in that, the jar or, package, whatever you want to call, how much, or is there enough live microorganism? That's important. Okay, it's a live microorganism. So do they have enough microorganism? No, live microorganism. And how long those microorganisms stay alive? So they have expiration date, right? So by the end of the expiration date, do they have 50% alive microorganism? Does it mean enough? Still enough? Those things are quite important to know. And content accuracy, is the label really correct? Or the amount they claim to be in the product, is it really true? So there is an interesting study done by Dr. Vісь in Canada. He picked 44 different human or veterinary probiotic products. He just picked 44. And they looked into it. He looked into it. Then he found organisms were improperly identified. Whopping 43% of the time in human products, and then 35% of veterinary products. It's you have a patient or the owner, I just get the probiotic from so and so, market. I like to use this one. I don't really like to use what you recommend, but it's always each product, even if they say, the two products contain, the label says contains the same thing, same amount, they may not contain the same thing in the same amount. So that's what Dr. Vісь, showed in this study. And interestingly, they had 25% of the time humans, and then 18% of the products, veterinary products, had a misspelled content. Come on. It's your product. That's what you want to sell, right? So you cannot really misspell it. So, it's unfortunate. And then it seems like that, check is not even going through. And only 9 out of 21 human products, which is 43%, not even half of it. And when it comes to veterinary products, only 2 out of 23 products, which is a 9%, contents adequately identified. It's really, really small amount. So the total 11 products, 25% of the products are accurate. And then the other 75% are not accurate. So it's quite sad to see these. So That's what I'm saying. It's really, really important to know which product has extensive study, because when they have extensive study done, that's usually more reliable than, hey, I just show you, I give you this contains this. Oh, don't worry, I just told you this contains this, rather than showing that, hey, here's the study, what we did, product control and then stuff. And then also if they can provide analytical data, that's even more trustful. So the next few minutes, I'd like to talk about a new product from Purina. It's a Fortiflora Plus. Fortiflora contains probiotic Enterococcus faecium SF68. And this Fortiflora Plus, in addition to the probiotic, it has psyllium, which is a plant-based fiber, and it is a prebiotic. So probiotics, we already said, it's a live microorganism, right? And prebiotics are the food, which is often fibers for the gut microbiota. And when you combine those probiotics and the prebiotic, it's called symbiotic. And they actually provide synergistic effects for that gut microbiome. So psyllium is a soluble fiber which improves fecal consistency by binding water, and that influences microflora population. They also fermentate itself and then produce a volatile fatty acid which promotes colonic regeneration. So here's the diagram, so symbiotic action of the probiotic and a prebiotic. So on the left side of psyllium is drawing water, and it has a high water holding capacity. And then so that normalizes to passage. And then also itself gets fermented and then produce short chain fatty acids. You can see in those blue dots and with the red dots, and that they are the primary fuel source for colonocytes. And then by fermentation, that it decreases the pH, and then that actually helps to promote more, eliminate the bad bacteria or harmful, or reduce the population of harmful bacteria. And then, as you already know, probiotic, they stimulate the intestinal immune cells and the systemic immune response, as well as provides the physical barrier for those intestinal cells. So, as a take-home message, GI microbiota plays important roles in many organ systems, not just the GI, but many organ systems, including skin. And promoting a healthy gut microbiota can lead to better management of many diseases, not just the GI, but the whole system, including those veterinary dermatology. You may see the benefits. But as I already said, we need more studies. And more importantly, not all probiotics are made equally. So you have to choose the ones extensively studied and then can provide analytical data to you. At last, Fortiflora Plus contains a probiotic and a prebiotic for synergistic effects to promote healthy body functions. Thank you for listening to this lecture. I hope you enjoyed it and I hope to see you next time. Thank you.